We are extremely honored to have Dr. Katz speak as this session is part of our series Steps Up, a series to teach effective prevention skills among underserved populations. Dr. Katz is the founding director of Yale University's Prevention Research Center. He received his BA from Dartmouth College, his MD from the Albert Einstein College of Medicine, and his MPH from the Yale University School of Public Health. You could read all about him at davidkatzmd.com. So, Dr. Katz, welcome.
Thank you, Leslie.
I wanted to start by just having you maybe talk a little bit about what you do and the research you've done on prevention in your center.
Well, basically what I do is try to reverse trends in obesity, diabetes, related chronic disease, in the ultimate hope of adding years to life and life to years. We've known for at least 2 decades that chronic diseases are the major scourge of modern epidemiology, affecting all developed countries and developing countries. And we've also known that when we chronicle the leading causes of premature death, the things that take years from life and life from years, it's a very short list of chronic diseases we all know and most of our families have experienced: heart disease, cancer, stroke, diabetes, pulmonary disease. And if we go one step further, as a whole sequence of leading epidemiology researchers have done, we know that in fact diseases aren't really causes. Diseases are effects, and we know what they are effects of. And almost all of the chronic diseases that affect us are the result of a list of about 10 behaviors which overwhelmingly we have the capacity to control in our daily lives, but which unfortunately most of us don't. And that list of 10 in turn is overwhelmingly dominated by just the first 3, and those 3 are tobacco use, dietary pattern, and physical activity, or as I like to refer to them, feet, forks, and fingers. And so essentially what I do in every venue and by every means at my disposal is attempt to empower people to make better use of their feet, forks, and fingers. We have, in fact, at Yale's Prevention Research Center done some smoking cessation research, but mostly we're focused on feet and forks. We want to improve diet, improve physical activity, because just getting those 2 right has incredible potential to add years to life and life to years. We conduct research in community settings. We design and implement programs in schools. We design and implement programs in churches. We design and implement programs in work sites. We design and implement programs online. We design and implement programs in supermarkets. What the research lab does is test hypotheses about what these programs can do, make sure that they're working as intended, and then I use my nonprofit, Turn the Tide Foundation, as a vehicle. Once we have programs that clearly work, we want to take away the barriers. We want to make it possible for schools to offer state-of-the-art wellness programming. We want to make it possible for supermarkets to offer nutrition guidance. And so we use the nonprofit to develop means of disseminating our programs. And then to button it all up, I view the problems that cause epidemic obesity, epidemic diabetes, as being rather like a flood, a modern obesogenic flood. And obesogenic means things that cause obesity. Morbidogenic is things that cause morbidity or disease. So it's a great big modern obesogenic, morbidogenic flood. We have all of these highly processed foods that are aggressively marketed to us. We have all sorts of labor-saving technology that does everything our muscles used to do. And so the challenge for us really is to contain that flood and turn the tide. And we view all of the programs that we develop like sandbags in a levee. And ultimately, when the levee's high enough, it will contain these toxic floodwaters. It will turn the tide. And I want to be around when that happens. So I spend every day stacking sandbags.
That's great. What have you found to be the leading reasons why people don't make change, why people don't choose to eat healthy foods, why people don't choose to move their bodies more, exercise more, when I feel there's so much information out there. We all know we should be doing it. Is it lack of access? is it really lack of knowledge at this point, or is it lack of will, or what do you think it is? And and then on the flip side is, what are things we could say or do to change that?
Right. So a couple of framing comments, and then I'll try to answer the question. First, we like to say that knowledge is power. Would that it were so. At both the individual level and the societal level, the gap between what we know and what we do with what we know belies that wishful thinking. So there's a translational divide. How do I take what I know? Fruits and vegetables are good for me. Exercise is good for me. How do I put that to work? So knowledge is not power. Knowledge is prerequisite to power, but there's something else required, and it's often missing. One of the great problems with the information we disseminate is that it's about the public. So yes, it's true, if we consistently made good use of our feet, forks, and fingers, if we didn't smoke, ate well, and were active, and if we controlled our weight, we could eliminate 80% of all chronic disease. We could eliminate 90% of diabetes, 80% of heart disease, as much as 60% of cancer. It's absolutely stunning. But who am I talking about? You know, who is this public? It's not you and it's not me. Well, that's the fallacy. It absolutely is you, and it is me, and everybody else. Because if anyone in your family, if anyone you love has been affected by heart disease, if anyone you love has been affected by cancer or stroke or diabetes, or if you yourself have been affected by heart disease, cancer, stroke, diabetes, when we say we could eliminate 80% of all chronic disease, this means for 8 out of 10 of us on this webinar who love somebody who's had one of these diseases, it didn't need to happen. 8 out of 10 times. It didn't need to happen. And we could give our children a future where those terrible phone calls about someone being in the emergency room or the ICU or the CCU don't happen 8 times in 10. So one of the mistakes we make is to talk generically about a public nobody loves and fail to put a face on this and say, this is actually about the people you do love. This is about the quality of life your children will have. So I think we need to invoke passion. I don't think knowledge is the same as passion, and I think we need both. But then there's another critical fallacy. So sometimes we're not sufficiently motivated because we don't realize how personal this is. This is about us. It's up close, it's personal, it's not about some generic public. But then we assume as long as we care, we'll get the job done, and that's because our culture tells us where there's a will, there's a way. But you know what, Roxanne? That's baloney. Where there's a will, there may or may not be a way. And if you've got the will to be thin, and frankly, let's face it, most people want to be thin, so they're motivated. Now, my patients don't need me to tell them that they should be thinner for their health. They look in the mirror and think, gee, I wish I were thinner. You know, I mean, that's our cultural norm. They don't need me for motivation. They're motivated. They just don't know how to get there from here. And so the problem is there may or may not be a way, even if you've got the will. And what we need to do is both cultivate the will and then pave the way. In the Spider-Man movies, we got the line, with great power comes great responsibility. In public health, we need a corollary. Before we ask people to take responsibility, we must make sure they are empowered. So I tell people exercise is important. They know it's important and maybe they care, but then they have a crazy, hectic schedule where they're working their butts off. They're exhausted at the end of the day. They've got kids to take care of. They've got errands to run. You know, they worked 8 or 9 hours and did a couple more hours of chores. And frankly, they're fried and don't have time left or energy left for exercise. And I can't blame them. And we tell kids they should get exercise, but then we send them to school and bolt them to chairs all day long so they can grow up to become adults we can't get off couches with crowbars. Schools are jettisoning physical education in recess. When the heck are the kids supposed to get the exercise we tell them they need? And then we tell people to eat well. And then we bombard them with advertisements for all the very foods that speed us toward obesity and chronic disease. We flood the internet and the airwaves with marketing designed by highly paid, very smart people working on Madison Avenue to bamboozle 6-year-olds. And then we expect 6-year-olds to eat well in spite of it all. Forget about it. So, you know, we're profoundly disempowering people in their efforts to eat well and be active. So how do we fix this? Well, for one thing, we do need to cultivate the will. We need every family to understand this is about you. This is not about the generic public. If you love somebody who's had a heart attack, if you love somebody with diabetes, if you love somebody who's been diagnosed with cancer, if you've been through this once or more than once, this is about you. 8 times in 10, that stuff doesn't need to happen at all. Those dreadful days, those trips to the hospital don't need to happen. That's the future we want to give our children. So this is about every one of us. We've got skin in the game. Now we need to care a lot. Once we care a lot, we have to be empowered. So back to those sandbags in the levee, we teach children and parents how to identify and choose more nutritious foods with a free program called Nutrition Detectives. We provide a free program for schools to fit physical activity in throughout the day without taking any time away from teaching, called ABC for Fitness. We designed a free program for adults to fit bouts of physical activity into the workday without taking any time away from work, in fact, while enhancing productivity. If we're going to tell people they need to choose more nutritious food, we have to make it easy for them to identify. And we need an objective third party that's committed to public health to do that, not the folks who are trying to sell you the food. So we've done that with a program called NuVal, which is in 1,700 supermarkets in 32 states, reaching about 30 million people. 1 to 100, the higher the number, the more nutritious the food. So the tips, Roxanne, basically what I would ask of you if you were my patient is, do you care about this stuff, yes or no? If you don't care, all I can tell you is why you should, but then ultimately caring is up to you. And there's a whole science of motivational interviewing. I can help you decide to care, but that's a time-dependent process. So let's assume that everybody on the line and the kinds of people who tune in to a health-related webinar are probably more inclined to care than the general public anyway, so we're the folks who care. Now tell me what to do. Well, let's recognize, first of all, that this isn't about finding time for exercise. This is about making time for exercise. You don't find time to brush your teeth. You don't find time to put on your shoes. You don't find time to take a shower. This is stuff you have to fit in every day. No matter how busy your day is, it gets done. Your teeth get brushed. All right? So physical activity of some kind needs to be enough of a priority so that it's just something you do. That's your part of the bargain. You have to care enough to make it a priority. And frankly, you may say you're too busy to exercise, but I say I'm too busy not to exercise. The evidence is overwhelming that exercise enhances productivity, mental acuity, concentration. I'm better at what I do because I exercise every day. It dissipates stress. It helps you sleep better, and on it goes. So I frankly think anybody who wants to be productive, anybody too busy to exercise is too busy not to exercise. And the other thing is you can pay now or pay later. People can't find time to exercise or to be thoughtful about food preparation, but everybody finds time to ride an ambulance when they have to. And every parent finds time to take their child to the pediatric endocrinologist when they have no choice. So you can decide, I'm going to invest in health kind of the way I invest in wealth. I don't wait for Chapter 11 bankruptcy to decide, oops, I've got a problem. I manage my accounts, and I don't spend every dollar I make today because I know I may need some tomorrow. So I've got a savings account. If our culture taught us to treat health just a little bit like wealth, so we invested in it today, even if it was a little bit inconvenient, so that it would be there for us tomorrow, frankly, we would be out of this dark wood already. And then, so, part one is I think you really need to care. Part two is you have to make this a priority and accept some responsibility. And part three is guys like me who devote our whole careers to this have to come up with programs for you so that it's not so damn hard. It's too hard. It's unfair to say you need to choose better foods and then make it impossible for you to tell which the better foods are because the front of every package is cluttered up with marketing material. So that's the third tip, Roxanne. People need to identify programs they know and trust. Mm-hmm. If people know and trust me or the programs that my organizations represents, use NuVal if you have the opportunity. Use Nutrition Detectives. It's available for free. Use ABE for Fitness to fit physical activity and throughout your workday in the office while wearing business attire, so you don't have to find time before or after work. So it's our job to grease the skids, our job to empower you so that you can get there from here, but then you've got to decide you care enough to make it happen. And you have to acquire skills for healthy living. It's sort of too bad that healthy living takes skill, but in the modern world it does. So you have to commit to knowing how to identify and prepare more nutritious food. You have to commit to managing your time so you can fit physical activity in. but the return on that investment is truly luminous. It's worth it.
To learn more about your programs, New Val.
My site links to everything else that I do, so that would be good one-stop shopping. There's a link from my own website to the Prevention Research Center. There's a link from my website to the Turn the Tide Foundation, where we have all of these programs. And right from my homepage, there's a link to several of these programs. So yes, if we're going to do one-stop shopping, davidkatzmd.com. And again, just to reiterate, most of the programs I'm describing are available completely for free. NewVal is a supermarket-based program, so some people have access in the store, some don't. But Nutrition Detectives is a DVD available in English and Spanish. We designed it for kids, but when we tested it, it was just as relevant to parents. And it teaches food label literacy, what matters about a food label, how to identify the better choice. It's free. ABC for Fitness is a comprehensive manual to fit physical activity into the school day of a child. It's free. ABE for Fitness is a program of videos accessible online. So any computer or smartphone, just go to abeforfitness.com. And you can create a playlist of 3 to 8 minute fitness routines that you can do intermittently throughout the day, much better for you than having an energy drink, as you may have noticed in the news recently. So all of this is, and many more of the programs that I feel are the kinds of things that can empower people to get there from here. We do our utmost to make available to everybody for free. I just posted a link for one of the columns I wrote recently on the Huffington Post about this comparison of health to wealth. I write several times a week for the Huffington Post. I write once a week for U.S. News and World Report, and I'm easy to find online. All people really need to do is Google my name, Dr. David L. Katz, and they'll easily find this. So, you know, for those who find this discussion useful but would like more, there's an awful lot more. I'm opining routinely online, and certainly invite people to check out that information. And if you want to know when I'm posting something, on my website you can follow me on Twitter, and I always tweet the URL for anything new that I post online.
If we want to make a difference as individuals in this field, what would you recommend?
Well, I suppose it's a perfect opportunity to quote Margaret Mead, who said, "Never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, it is the only thing that ever has." So I think individual level change and commitment matters because, you know, culture begins under our roots. Culture begins at the level of household. If we make health a priority, if it's a priority for our kids, then they talk about it with their peers. We talk about it with our peers. Ideally, we pay it forward. Other households make health a priority. The next thing we know, we are a small group of thoughtful and committed citizens. We're parents who send kids to the same school, and we won't take no for an answer. And we insist on meeting with the principal or the superintendent and saying, you know, I am turning over to your care, to your responsibility daily, the people I love most in the world. Take care of them. I expect you to take care of them at the highest standard. I do not want my kids fed junk in your school. Tell me what you're going to do about it. I am a parent. I insist on this. When enough of us insist on it, it has to happen. Ultimately, this is about culture. Now, you know, in terms of the hypocrisy you were pointing out, this is a cultural anachronism. Throughout most of human history, let's face it, calories were relatively scarce and hard to get, and physical activity was unavoidable. It was called survival, and everybody did it every day. It's only in very recent times that physical activity is scarce and hard to get and calories are unavoidable. So essentially, we solved the age-old problems, overshot, and created brand new problems, and we haven't yet gotten our footing. I mean, you know, it's not normal yet in our society to look at people eating junk food and roll our eyes, because we all eat junk food too. You know, it's still normal to do that. It's still normal to watch parents of obese children feeding them foods that are probably cultivating ill health and propagating that obesity, and we're still okay with that. It's still okay for everybody who has type 2 diabetes to drink soda. Now, it's not okay for parents to give young children cigarettes. It's not okay for people who use illicit drugs to give other people illicit drugs. We have certain cultural barricades against harmful behavior, but we haven't figured out how to apply them yet to food and the use of our feet, because this is all fairly new, and we're still trying to figure this out. It's also pretty tough to put the brakes on something like food, because again, it's really deeply ingrained into our culture that food is good. Food is even a currency. right? I mean, we used to think about food and wealth in the same way because we talked about being breadwinners, making dough and bringing home the bacon. You know, food and money really were the same thing. So we're trying to sort this out. And that's the reason for the hypocrisy. I refer to it as cultural anachronism. What our culture needs is new, and what our culture has is sort of the time-honored stuff. I think ultimately the solution is cultural. I think we need a culture that reveres health the way our culture has tended to revere wealth. And I think that can begin one household at a time. It can certainly begin one congregation at a time, one employer at a time, one inspired teacher or principal or superintendent at a time. And what we're trying to do goes beyond developing programs. I'm doing my utmost to get with like-minded people in positions different than mine, to get with pastors, to get with employers, to get with superintendents who understand all of this and say, yes, let's work together. Let's work together, but let's be respectful of one another. If I'm a superintendent, I've already got a mission. I have to worry about standardized test scores. I've got to worry about reading, writing, and arithmetic. My day job is pedagogy. It's not public health. And I say, that's fine. My day job is public health. I'll do what I do, you do what you do, and if we put them together right, we both win. And in fact, we've been able to demonstrate exactly that. Our school-based health promotion programming is actually associated with at least preservation of standardized test scores, if not improvement, and improvement in the behavioral environment in the classroom. The kids behave better. They're less disruptive. We actually make the teachers' teaching easier. With ABC for Fitness, we can actually increase teaching time every day, even as we give the kids physical education. These are the kinds of win-win scenarios we have to be thinking about, because then everybody is willing to join in the new culture of health. We can get there from here. I'm cautiously optimistic. We will see this tide turn. We're just not there yet.